Hi, everyone. Welcome to Band-Aid Lyme's interview series. And we're starting a new series. And today we have Dr. James Schaller. He's a world-renowned Lyme disease and co-infections doctor. And I'm going to let him introduce himself.
Well, I've been in private practice for 31 years, and 29 of those years I've been treating tick infections, particularly Lyme, Babesia, and Bartonella. Those are the three bad bees. And I've written about 13 books on these infections, and I'm very committed to treating it. I'm very passionate about it, and I do accept new patients. And there's a lot of free books on my website, personalconsult.com.
And I will also have that on the website for those of you who need that link. Okay, so we're going to start in with, we have several topics that we're going to go over in this series, but today, the first one we're going to start with, Dr. Schaller, can you just tell us what are the symptoms of Lyme, Bartonella, and Babesia? And that might be a very loaded question.
Well, it is very full because all of them can cause over hundreds of possible symptoms. And I do have a book that's free on the website with checklists where people can go down and see, maybe I have this, maybe I don't. Oh, yes, I do have this. And it may help them. But I think with Lyme, looking at joint issues, looking at cognitive changes, brain fog, all kinds of psychiatric problems, all kinds of neurological problems, and fatigue. I know when my children had it, and that's one reason I got into it, because all my neighbors, patients, and family all had it. It was hard to get them out of bed. So, and trouble functioning at school with Lyme. Now, Babesia may be more dangerous. Babesia is not a bacteria. It's a single-celled parasite. And yes, we do have them in North America. And that has to be killed by entirely different means than Lyme. And probably the more common symptoms are sweats, chills, fevers, migraines, maybe muscle spasms. And then Bartonella, I would say every psychiatric disorder that exists. And we're going to talk later about the rage that you can get from Bartonella. It's not just a Ted Nugent song, Cat Scratch Fever. It's a real entity. And Lyme does the same thing. So all three of these infections can get into the brain and cause brain impact. And they have access to all the tissue in the body. So they can affect any part of the body.
And Dr. Schaller, now, how quickly, so Lyme disease, usually people use that as a catch-all phrase and they don't necessarily even understand what they're saying. But Lyme disease, when we specifically say Lyme disease, we are specifically referring to the Lyme disease bacteria, which are called Borrelia. And of Borrelia species, there are many different types of Borrelia. And now we also have Bartonella, there's also multiple different species of Bartonella. Babesia, there are multiple different species of Babesia. And then there's all those other little infections. Maybe they're not so little, but Anaplasma, Ehrlichiosis, Rocky Mountain, all those various different types of things that sometimes come in the whole kitchen sink of an infection, or either one tick bite or multiple tick bites. Now, when a person, let's say a person is bitten by a tick, and that tick perhaps was infected with, let's say, Borrelia burgdorferi, one of the most commonly known species of Borrelia in the United States. Bartonella, let's say maybe they have Bartonella cantana or Henselae, and maybe Babesia microti or Duncani. Now let's just give that as a sample example. How quickly do some of those infections leave the bloodstream? We know Babesia is a parasite that attacks the red blood cells, so that's going to be in the bloodstream, in the red blood cells. However, we know that Lyme and Bartonella do something different. Can you explain to the audience what Lyme and Bartonella do and how quickly they leave the bloodstream and go elsewhere?
Well, Lyme disease, the bacteria that looks like a corkscrew, which actually looks a lot like syphilis, only it's more aggressive than syphilis in many ways, that tends to drill into tissue. It's in the joints in 25%. It's in the brain 100% of the time in 2 weeks. And so it's not hiding anywhere in the body. It's very present throughout the body. And Bartonella is around the red blood cells, the lining of the red blood cells, the lymphatic tubing, and many other parts of the body. And there's famous pictures from various sources, maybe a couple from one of my textbooks, showing stria. They're not stretch marks. When you biopsy those, you find Bartonella. So I think all three of them I would see as having full access to the entire body.
And these are not benign infections or bacteria / viruses, parasites. These are very destructive stealth pathogens. Would you agree?
Absolutely. They're dangerous, and they certainly destroy functionality, and they can destroy your ability to think, your neurological functioning, your psychiatric functioning. And as you mentioned in that example, that's not rare. My average patient has 3 infections, not just Lyme, not just Bartonella, not just Babesia. They have at least 3, and some have many more.
Yes, indeed. Now, when these infections go neurological, so when some of your patients are saying, oh goodness, I feel like things are crawling in my brain, I have brain fog, I'm having vision problems, et cetera, et cetera. How long, if a person is untreated, how long, or even if treated, how long would it take for the brain to be destroyed or damaged rather from these infections if a person is treated or untreated?
Well, I think there's a little bit more forgiveness than I originally thought 29 years ago. I am getting patients that have been infected 30 years, in my opinion, and there's reversible issues.
Okay.
There are some that have very complex neurological damage that they may need stem cells or other things to regain some of their lost function. But most people, they get away with it not being caught right away, which is kind of exciting. So somebody may have very painful joints, and I'm thinking, well, they have Lyme arthritis, but it reverses with treatment and they're okay. So not everybody goes to bone on bone after 6 months of Lyme, which is great.
Yeah, no, that is promising. I mean, I know, gosh, there's a whole spectrum of people in the United States and beyond who are infected that very well go years and years. They don't even know what's wrong with them, and they're self-medicating perhaps in different ways. They think, oh, this is just maybe normal part of aging, and they're 30 years old or 40 years old or 50 years old, whatever. But
if I could be rude, you just said something so profound. I am hearing all the time this comment, it's part of normal aging. You should expect to be healthy and active till you're 85.
Wow.
This whole idea, if you're working with a doctor that will replace your sagging hormones and not leave them like they were 100 years ago, but put them where they should be, where you were 25. So anybody under 85 that uses that expression, I jump right away and say, no, 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 absolutely not, please.
Okay. Because I've heard this from other people and they thought, well, I just thought this was a natural part of aging. I'm a hard worker in certain ways, or I'm a housewife, or, I have several children, or from a man's perspective, perhaps I'm a day laborer, or I do things in the yard regularly, or etc. I just thought this was, my knees going bad, or joint issues, or what have you, or maybe my vision was getting bad, or etc. So that's a good thing to clarify for folks who believe that this might be a normal part of aging, or these strange, obscure signs and symptoms, they actually may be attributed to something else. And which might lead me to another question to ask you. How easy is it to I don't want to necessarily just say get bitten, because we know this is transferred in many ways. So let me back up a question. What are the different ways that one may be infected with these infections?
Well, ticks are a walking petri dish, and the numbers of things they carry, it's quite vast. I would say there's about 8 possible infections that the ticks can carry. Some would say more, some would say it's more important to look at less. Thankfully, I'm not seeing people with 8, even those that have been in high tick exposure. And then in terms of Bartonella, there are many insects that carry Bartonella, and even some wild cats and wild dogs can carry it. And most mammals are being found to have a form of Bartonella, but thankfully not every dolphin has it, not every whale has it, but we're finding it's everywhere. And when I wrote a paper on depression and Bartonella, I believe it was 2004, I was shocked. I think I put in there were 4 species that infected humans. Now we're up to 22, and that's rising. And that wasn't very long ago.
Was that dated 2000? Was that your 2007 paper, I think?
You may know better than me.
Okay. I think it was. Okay. So, but Lyme, Bartonella, and Babesia, from the research that I've read, and some of the other physicians actually worldwide that I've spoken to that have also done independent research in Europe and beyond, some of them have noted, well, there's different ways you can actually get this. Bed bugs, biting flies, biting spiders, mosquitoes, ticks, fleas, sexually transmitted, congenitally transmitted, meaning from mother to child. For not everyone might not understand what congenitally means. So mother to child, organ transplants, blood transfusions. I think we've covered,
Jump on that.
crabs, lice, and potentially pubic crabs.
Yeah, I think all the things you mentioned are definitely true with Bartonella. And I don't think it's controversial. I think you're dead right. And that's why I personally lean towards Bartonella is the Lyme of the future, and Bartonella is no joke. I do believe that in terms of the baby being influenced in the womb, that Lyme, Babesia, and Bartonella are transmitted. However, it appears that if you're under treatment for those things, people are doing quite well, and a number of people are agreeing on this. They're treating pregnant women who have these infections, and then they test later and things seem to be fine, which is exciting.
Well, let me ask you one little question as a stem off of that. Now, in my travels, I've met many couples with all of the same strands of everything being simultaneously treated at various clinics or offices, and I've become friends with these various people and individuals. And my question to you is, if a couple both have Lyme and the same infections, but they're both under treatment, would they be able to have a child, a healthy child?
I believe they could under treatment. I do. And I think it comes back to something that I think is really important. The first thing with these infections is you stun them. You just stun them. You don't need to go crazy. Then you stop reproduction. And then you try to lower body load, maybe 1% a year, a month, excuse me, a week. And then you kill the persisters. Those are the bacteria that are left after you nuke them with antibiotics. And only then do you look at biofilms. And my Amazon One biofilm book is free off my website. So coming back to this, I believe that at the very least, both man and woman, if we're talking about a traditional couple, are having stunning of the infections and preventing reproduction and probably lowering body load. So the ability of these infections to be aggressive, I think, is dampened.
Okay. All right. That's promising, because unfortunately, one of my relatives, interestingly enough, I won't go into too much detail. One of my relatives the couple became pregnant, and one of my relative had Lyme disease for years. And when the couple became pregnant, the other party that was not Lyme positive initially was not treated, nor did that person likely know that it was likely an STD. Now, one of their offspring was born without a thyroid. And I think in my mind that this was a direct result of the other party not being under treatment properly. And I feel as though that particular result in the child was a direct result of, not both parties being treated properly through the course of the pregnancy.
I think there's still a little bit of a debate about how sexually transmitted these three, Lyme, Babesia, and Bartonella, are. I lean towards that they probably are, not the least because Lyme is much more advanced than syphilis. And I would agree. What I tell people is, if you're not using protection like a condom and all the other options, then not only do you want to get pregnant, but you need to think about both being treated to avoid what you just said.
I agree with that 100%, Dr. Schaller, just based on my own research and observation and direct experience with a number of couples. So I think the audience will appreciate hearing that information because it's very informative and educational. So we have covered most of pretty much this topic of discussion, which we started out generally by asking what are the symptoms of Lyme, Bartonella, and Babesia. And so we've covered a bit of this information. So I just want to tell the audience, this is going to be the start of, well, hopefully a long-standing relationship and a long-standing interview process with Dr. Schaller and myself, likely over the next year or even longer, however long you want to go, Dr. Schaller. However long the good Lord lets us live.
You're the greatest. I think the world of you.
So thank you, Dr. Schaller. So So we will stop with this discussion, and we actually are going to continue on with another topic. So for
Okay.
those of you who'd like to listen in, just click on the next topic, and we're going to stop here. Thank you, Dr. Schaller, for this little discussion, and now we'll move on to the next one.